everyone. Today, I will be presenting an organizational analysis of Nemours Children's Health, which is one of the nation's largest nonprofit pediatric healthcare systems. Throughout this presentation, I will examine the organization's leadership, culture, management practices, healthcare delivery model, workforce, financial operations, and the strategies it uses to fulfill its mission while addressing today's healthcare challenges. I am Jasmine Cireus, and let's go ahead and continue. Nemours Children's Health is a nonprofit pediatric healthcare system, which was founded in 1936 through the legacy of philanthropist Alfred DuPont. Today, the organization serves children and families across Florida, Delaware, New Jersey, Pennsylvania, and surrounding regions through the children's hospitals, specialty clinics, primary care practices, research programs, and telehealth services, according to Nemours Children's Health in 2023. Unlike many of the health systems that treat patients of all ages, Nemours focuses exclusively on pediatrics. Its mission extends beyond treating illness by improving children's health through research, education, advocacy, prevention, and community partnerships. This specialized focus has allowed the organization to become a national leader in pediatric healthcare while continually expanding access to high-quality services. Understanding the organization's background provides a foundation for examining the mission and vision that guides its decisions. The mission of Nemours Children's Health is to help children grow into healthy adults by creating the healthiest generations of children. Rather than solely focusing on medical treatment, the organization follows a method which is called the whole child health model, which recognizes that a child's health is influenced by physical, emotional, behavioral, and social factors. Its long-term goals include improving health outcomes, reducing disparities, expanding access to care, strengthening community partnerships, and advancing pediatric research and innovation. These priorities demonstrate that Nemours views healthcare as more than just treating a disease. However, it aims to improve the overall well-being of children and families. The mission also guides an organizational decision-making by encouraging leaders to invest in preventative care, evidence-based practice, and long-term community health initiatives. Achieving these goals requires collaboration with many partners outside of the hospital, though. So, Nemours recognizes that improving health cannot be accomplished by hospitals alone. The organization works closely with schools, community organizations, public health agencies, healthcare providers, researchers, and government partners to address issues affecting children's health. The community health needs assessments completed in Central Florida and Delaware identified several priority concerns, including behavioral health, access to health care, and social determinants of health. These findings in 2024 and 2025 help guide partnerships and resource allocation so that the organization can better meet the needs of the community it serves. These collaborations strengthen care coordination, improve access to services, and support prevention efforts. Despite these partnerships, Nemours continues to face many of the same challenges affecting healthcare systems nationwide. One of the most pressing is the growing demand for pediatric behavioral and mental health services. Many communities continue to experience shortages of pediatric mental health professionals, making timely access to care quite difficult. Another challenge is addressing health disparities. Children from underserved communities often experience differences in healthcare access and health outcomes, making equity an important organizational priority. Finally, workforce shortages continue to affect healthcare organizations across the country. Recruiting and retaining qualified healthcare professionals while maintaining high quality patient care requires strong leadership and effective workforce planning. After examining the challenges facing the organization, let's look at the leadership approaches that help Nemours respond to these issues and achieve its mission. One of the reasons Nemours has remained a leader in pediatric healthcare is its leadership approach. Rather than solely relying on one leadership style, the organization incorporates transformational, servant, and collaborative leadership. The incorporation of transformation and collaborative leadership help guide decision making and organizational growth. These leaders encourage innovation, professional development, and continuous improvement while empowering staff to contribute ideas that enhance patient care. Collaborative leadership is equally important because pediatric healthcare requires physicians, nurses, therapists, administrators, and many other professionals to collaborate toward common goals. According to Nemours Children's Health Leadership and Governance in 2025, leaders are committed to advancing the organization's mission while fostering accountability, innovation, and teamwork. This leadership approach helps ensure that strategic decisions remain focused on delivering high-quality, family-centered care. Effective leadership shapes more than just organizational strategy, though. It also influences the culture employees experience every day. Organizational culture is the shared values, beliefs, and behaviors that guide how employees work together at an organization. At Nemours, the culture emphasizes compassion, collaboration, safety, inclusion, and continuous learning. Because pediatric patients often require care from several specialties, teamwork is central to the organization's success. Employees are encouraged to communicate openly, share knowledge, and work together to improve patient outcomes. A strong safety culture is another important characteristic. Finn and colleagues in 2024 found that healthcare organizations with positive safety cultures experience better teamwork, stronger communication, and improved patient safety. These principles align closely with Nemours' commitment to quality improvement and family-centered care. Overall, the organization's culture supports both employee engagement and high-quality clinical outcomes. A positive culture makes it easier for leadership to achieve the organization's mission and long-term goals. Leadership plays a critical role in translating Nemours' mission into everyday practice. Instead of simply setting the goals, leaders ensure that decisions about staffing, budgeting, technology, and quality improvement all support the organization's commitment to whole child health. According to Nemours Children's Health Leadership and Governance in 2025, leadership remains focused on innovation, quality improvement, long-term community impact. By aligning strategic planning with the organization's mission, leaders create consistency between organizational values and daily operations. While these leadership practices provide many advantages, every organization also has areas of strength and opportunities for improvement. There are several notable strengths that Nemours has. Its exclusive focus on pediatric care allows the organization to develop highly specialized expertise that distinguishes it from many general hospital systems. The organization is also recognized for its commitment to research, innovation, community partnerships, and family-centered care. They have a very strong national reputation, and again, as previously discussed, they specialize in the whole child healthcare model. This model addresses not only medical conditions, but also the environmental and social factors that influence long term health outcomes. However, the organization does have challenges that it faces. They must address workforce shortages, rising healthcare costs, increasing demand for behavioral health services, and persistent health disparities. On top of all of that, there are so many technological changes that are happening in this day and age, and the organization has to work 10 times harder to keep up with it. Recognizing both these strengths and weaknesses allows the organization to continue improving while adapting to changes in the healthcare environment. One way that Nemours addresses these changes and challenges is by applying principles associated with high reliability organizations. A high reliability organization is an organization that consistently delivers safe, dependable care while minimizing preventable errors, even in complex and high risk environments. Although the environment of Nemours is constantly changing, Nemours demonstrates many high reliability organization characteristics through its environment commitment to patient safety, evidence based practice, continuous learning, and quality improvement. Employees are encouraged to identify potential risks, report safety concerns, and work collaboratively to prevent adverse effects before they occur. By promoting accountability, teamwork, and continuous improvement, Nemours strengthens both safety and organizational performance. Now that we've explored leadership and organizational culture, let's examine the management practices that support the organization's daily operations. So we've discussed leadership, and so now it's important to distinguish it from management. While leadership focuses on setting the vision, management ensures that the organization's daily operations support that vision. At Nemours, managers are responsible for planning, organizing, staffing, directing, and evaluating healthcare services. They oversee budgets, allocate resources, coordinate interdisciplinary teams, and monitor quality measures to ensure patients receive safe and effective care. Managers also use data to guide decision making. Information from the Community Health Needs Assessments helps identify healthcare priorities, evaluate organizational performance, and direct resources where they are needed most. This data-driven approach supports continuous quality improvement and helps the organization respond to the changing needs of children and families. Effective management not only depends on sound principles, but also strong management skills. Healthcare managers need a variety of skills to keep a complex organization such as Nemours operating efficiently. At Nemours, communication is especially important because patients depend on collaboration among physicians, nurses, therapists, pharmacists, social workers, and administrative staff. Managers must also demonstrate critical thinking and sound decision making. Every day they balance staffing, scheduling, budgeting, patient flow, resource allocation, and more while maintaining high standards of care. Another essential skill is change management. Healthcare is constantly changing and evolving through new technologies and regulations and shifting patient needs. Managers help patients and employees adapt by providing training, encouraging collaboration, and supporting continuous learning. These management practices ultimately support the diverse population of patients served by the organization. Nemours Children's Health provides care primarily for infants, children, and adolescents And in some cases, there are young adults with complex pediatric conditions that Nemours serves. Because pediatric patients rely heavily on family support, care is designed to include parents and caregivers as active members of the healthcare system. The organization treats a wide range of conditions from routine illnesses and preventative care to chronic illnesses, congenital disorders, traumatic injuries, and medically complex conditions requiring specialized treatment. According to Nemours Children's Health in 2023, patients receive care through children's hospitals, specialty clinics, primary care practices, outpatient centers, and telehealth services. This broad network allows the organization to improve access to pediatric care while meeting the unique needs of children at every stage of development. Providing care to such a diverse patient population requires an equally comprehensive model of healthcare delivery. So, the whole child health model recognizes that children's health is influenced by more than medical treatment alone. Physical health, mental health, family support, education, and social conditions all contribute to long-term well-being. To address these factors, care is delivered through interdisciplinary teams that include physicians, nurses, therapists, psychologists, pharmacists, dietitians, and social workers. Working together allows these professionals to develop coordinated treatment plans that address each child's individual needs. The organization also extends care beyond the hospital through community partnerships and preventative and health initiatives. The community health needs assessments identified priorities such as behavioral health, healthcare access, and social determinants of health, which helps guide programs that improve outcomes for children and families. Supporting this delivery model is a wide range of specialized clinical services. Of course, there are several services that Nemours offers, many of them being primary care, emergency medicine, cardiology, oncology, orthopedics, and neurology. Because the organization focuses exclusively on children, its providers have specialized training in diagnosing and treating conditions unique to pediatric patients. This expertise allows Nemours to care for them for both common childhood illnesses and rare medically complex situations. These services ensure that children and families receive coordinated, high-quality care close to home whenever possible. After exploring the services Nemours provides, the final section will examine the organization's workforce, financial operations, and overall performance. Nemours Children's Health provides care across the full continuum of pediatric healthcare, ensuring that patients receive the appropriate level of care throughout every stage of treatment. At the primary level, providers focus on preventative services such as wellness visits, developmental screenings, immunizations, and health education. Secondary care includes referrals to pediatric specialists for conditions requiring more advanced evaluation for treatment. For children with serious or complex illnesses, Nemours also provides tertiary and quaternary care. These services include neonatal intensive care, pediatric surgery, cancer treatment, rehabilitation, and multidisciplinary care for rare diseases. By offering every level of pediatric care within one integrated system, Nemours promotes continuity of care and better long-term health outcomes. Delivering this level of specialized care depends on having a skilled and engaged workforce. Nemours Children's Hospital employs approximately 10,000 associates across multiple states, including physicians, nurses, advanced practice providers, etc. Managing such a large workforce requires effective planning, communication, and leadership. The organization invests in recruitment, continuing education, leadership development, and mentorship to ensure employees have the skills needed to provide exceptional pediatric care. Nemours also emphasizes diversity, equity, and inclusion within its workforce. Building a diverse team strengthens collaboration and allows employees to better understand and meet the needs of the communities they serve. By supporting employee growth and engagement, the organization creates a workforce capable of adapting to changing healthcare environments. A strong workforce also contributes to higher employee satisfaction, which directly influences patient care. Employee satisfaction is essential because engaged healthcare professionals are more likely to deliver safe, compassionate, and patient-centered care. Nemours promotes a positive work environment by encouraging collaboration, recognizing employee contributions, supporting professional development, and maintaining a mission-driven culture focused on improving children's lives. Like many healthcare organizations, Nemours continues to face challenges related to staffing shortages and employee burnout. Addressing these issues requires leaders to prioritize employee well-being while maintaining high standards of patient care. Finn and colleagues in 2024 found that organizations with strong safety cultures experience better teamwork, communication, and employee engagement. These factors not only improve workplace satisfaction, but also contribute to better patient outcomes. By investing in its employees, Nemours strengthens both organizational performance and the quality of care it provides. In addition to managing its workforce, Nemours must also maintain strong financial stewardship to support its mission. As a nonprofit organization, Nemours reinvests its financial resources into patient care, research, technology, and employee development with a focus on community health initiatives instead of distributing profits to shareholders. Financial sustainability is especially important because pediatric healthcare often involves caring for patients with complex medical needs while serving families with a wide range of financial circumstances. Organizational leaders must carefully balance operating costs, workforce investments, facility improvements, and expanding access to specialized services. Nemours also provides financial assistance programs to help ensure children receive necessary care regardless of their family's ability to pay. Its revenue comes from a combination of commercial insurance, Medicaid, Medicare for eligible services, and self-pay patients. Responsible financial management allows the organization to continue expanding programs, investing in innovation, and fulfilling its mission of improving children's health. Finally, I'd like to summarize the key findings from this organizational analysis. In conclusion, Nemours Children's Health demonstrates how effective leadership, strong management, and a patient-centered culture work together to create a high-performing healthcare organization. Throughout this presentation, we examined how the organization's mission, leadership style, collaborative culture, workforce, and healthcare delivery model support its commitment to improving children's health. We also discussed important challenges such as workforce shortages, behavioral health needs, health disparities, and financial sustainability. One of the greatest strengths of Nemours is the whole child health approach, which recognizes that improving children's health requires more than just treating illnesses. By combining high-quality clinical care with research, education, prevention, and community partnerships, the organization addresses both medical and social factors that influence long-term health. Overall, Nemours serves as an excellent example of how nonprofit healthcare organizations can use leadership, innovation, collaboration, and continuous improvement to provide exceptional patient care while preparing for the future of healthcare. These are my references, and thank you so much for your time and attention.